Welcome everyone. My name is Chris Murphy. I'm Director of Marketing and Product Management with Alliance Payroll Services. I want to thank all of our clients and invited guests for taking time to attend today's event. As we all know, the Affordable Care Act is a very dynamic and fluid situation. Towards our goal of keeping our clients and colleagues informed, we are very excited to sponsor today's ACA Regulation Update. We'll now begin today's event that is going to be presented by Mark Lam, compliance expert at the Assurance Agency. Joining Mark today is Jason Blomquist, benefit specialist at the Assurance Agency. Jason is going to be reviewing your questions and presenting them to Mark. Mark and Jason, we look forward to your presentation.
Thank you, Chris. Welcome to today's Alliance Assurance webinar. My name is Jason Blomquist, and I'll be your moderator today. While I'm not moderating webinars, I serve as the Senior Vice President of Employee Benefits at Assurance. We appreciate that you've taken the time out of your busy schedules to join us and learn more about the recent IRS regulations updates for the shared responsibility provisions of the Affordable Care Act. Our presentation today will cover the recent health care reform regulation changes, many of which provide answers to those outstanding questions and offer compliance tips through 2014. With that being said, I'd like to welcome our guest speaker, Mark Lam. Mark is the Benefit Compliance Specialist at Assurance and creates high personalized client relationships through consistent communication regarding legislative and regulatory issues. He is responsible for a wide variety of activities, including supporting internal staff and clients with the compliance-related questions and working with the insurance staff on internal compliance projects. Mark is an expert on topics such as healthcare reform, ERISA, HIPAA, IRS, and other employee benefit regulations. Welcome, Mark.
Thanks, Jason, and good afternoon, everybody. Thank you for coming to the webinar today. We've got a lot to cover, so we're going to jump right into it. But this time is for you. We want to make sure that you get everything you need to get out of this webinar and have a very good understanding of where things are at with respect to the Affordable Care Act. A couple of caveats before I jump into most of the presentation here. Number one, as I'm sure you're aware, the Affordable Care Act, or the ACA, is a constantly evolving set of regulations at this point. It was very interesting. I got a funny picture sent to me by a coworker, and it was a picture of a copy of the original statute as it prints out, and as it was passed by Congress, which was 2,400 pages, and it looks like a yellow pages for Chicago or New York. It's 3 or 4 inches thick, right? And then they stacked next to it a stack of all of the regulations that have been published related to the ACA since then. And that stack was 7 feet tall. And that's not a joke. You get 10 pages of regs for every page of statute. So things are evolving. So there's a likelihood, or there's a chance, I should say, that we may talk about something and it literally may get modified today while we're talking about it. And I'm not joking. It's happened to me twice already in the last year that we've been doing this. So that's one thing. Second thing, we're going to focus primarily on what the law says, not a lot of the commentary about it. And that would just be another recommendation that I have for you is whenever you're talking about the Affordable Care Act, it's real easy to get caught up in the politics of it. It's highly politicized, obviously. It's real easy to get caught up in some of the commentary from the press, various opinions. Attorneys love to obviously weigh in on it and everything. And all of that's got some value to it. But the important thing is as a business owner, you need to know what do you need to do, and more importantly, what does the law really say? And that's what we're going to focus on here. I will keep my political comments bridled in. They may come out from time to time, and Jason will let me know that I need to shut up about that stuff. So anyhow, those are my caveats. Let's go ahead and get going. We're going to start with, or we're going to really call this presentation an introduction to shared responsibility. And the reason why we say that is you've heard it called probably the pay or play mandate. Shared responsibility is the set of regulations, the set of rules within the Affordable Care Act that deals specifically with an employer's obligation or non-obligation to offer health insurance to their employees. And that's where your costs are going to be incurred with the Affordable Care Act. So we're going to limit our discussion to that part of the Affordable Care Act. Now, to talk about that appropriately, it's important to know why employers offer health insurance to begin with. And that seems like it's an obvious question, but there's some very interesting things that a couple things we'll hit on to set the table as to why these rules exist and why we need shared responsibility, which will be our next subject. And then we'll get into the details about what you need to do. Now, throughout today's presentation, we'll talk about strategies. It's going to come up. You're going to have thoughts. We have thoughts. There's different things that we will talk about from a strategy perspective. And then when we wrap up, I'll hand things back off to Chris, and we'll take it from there going forward. So there's no doubt that the one provision of the ACA that affects employers more than any of the other provisions, and there's a lot of them, there are a lot of them, is shared responsibility, which says employers with 50 or more full-time employees employers with 50 or more full-time employees are responsible for complying with the shared responsibility provisions. Now, it's important to note, I had an attorney call me out on this. The attorney was technically correct. I'll reserve comment on how he called me out on this, but the bottom line is this. Shared responsibility says that you have a requirement to make a choice of either offering group health insurance coverage to your employees, your full-time employees, if you've got 50 or more of them, or you can choose to pay an assessable payment. That's how it's deemed or termed in the Affordable Care Act. The reality is in areas other than the preamble to the Affordable Care Act, it's an excise tax penalty. So it is a penalty, but the important thing that I want you to know is that if you end up making the decision not to offer coverage, you're not in violation of the law, you're not going to go to jail, but you're going to pay a pretty hefty fine for not complying with the coverage offering. In a nutshell, shared responsibility reads like this. Employers with more than, and we're going to define all of these underlying terms, employers with more than 50 full-time equivalent employees are required to offer minimum value health insurance coverage to their full-time employees. That coverage has to be affordable. It's not on here, but I'm going to add another phrase. It's got to be non-discriminatory. And employers with more than 200 full-time employees have to maintain their current enrollment and automatically enroll new employees onto a plan that they offer. So that is shared responsibility boiled down to one, a couple of sub-bullets there. That's a few hundred pages of regs boiled down into its essence. So you have to determine, are you an employer that has at least 50 full-time equivalent employees? If you are, your choice is do this or pay that $2,000 a year penalty, and we'll talk about those penalties down the road. So one thing I want to tackle here, actually kind of in a backwards way, and then we'll get into details on everything else, is this automatic enrollment function. And the reason I want to handle that first is because it's some good news. It's not in effect yet, and it's not going to be in effect most likely in 2014 when all these other rules do go into effect. The agencies, which would be Health and Human Services, Department of Labor, and the IRS, have not yet published the guidance that needs to be out there to make this automatic enrollment thing effective. But the way that this is going to work is basically like this. Today, if you have an employee who's eligible for benefits, I'm the employer, I hire an employee, they're a full-time employee, we've got a waiting period, let's say it's 60 days, and then that employee is eligible for benefits. What am I going to do? I'm going to give that person an enrollment kit, and I'm going to tell them I need you to fill this out and get it back to me by Friday. Okay, and if I don't get it back by Friday, and that's the cutoff date, I'm going to call, I'm going to say, hey, where is it? Oh, I didn't do it, or I can't track you down, whatever. End of the day, Friday, that's it. You elected to not take coverage. That's basically what that means today. What the automatic enrollment thing is going to be is there's going to be one more step, and that is that I bring you on, you get through your waiting period, I offer you the coverage, I tell you I need this form back by Friday. You don't get it back to me by Friday. Instead of saying you don't have coverage, what I'm going to say is, well, you didn't give me a decision, so I'm going to put you on this particular plan. Okay? And that's important because a lot of what was being published originally was automatic enrollment. Well, if you have more than 200 full-time employees, you got to put all of them onto your plan. And that's not true. That's not what's happening here. It's new hires only, and it's only if they don't make a decision. Because they could decide to opt out, and then fine, then they're out. They could decide to take whichever plan that they were entitled to take anyhow, and that's fine too. It's only if they don't make a decision. So that's all we're going to talk about, auto-enroll. We'll let everybody know if those regs come out and they actually do go into effect for 14. I would be shocked if they're in effect for 14. It is way too late to be telling large employers like this that this is going to affect them. But that, I've been shocked before by the agency, so, there you go. All right, let's dive into some details. Who are full-time employees and who are full-time equivalents? And let's get into some of that details. Well, the first thing you need to know is that a full-time employee is an employee who averages 30 hours of service per week or more. What is hours of service? Hours of service is an hour that a person is entitled to pay, or they're entitled to be paid for that hour, whether or not they actually performed their work duties during that hour. So for a salaried employee who's got paid vacation, let's say, it includes paid vacation time. You give them 8 hours of credit for each day that they're out on paid vacation or paid time off. Sick days, paid leaves, leaves of absences, I should say. Those types of things, whether they're hourly or salaried. If they're hourly, then obviously you're going to count the hours that you're paying them for, despite the fact that they didn't actually work. So a full-time employee is an employee who averages 30 hours a week or more. Now, this is important because this sets the baseline for who you have to offer health insurance coverage to. You have to offer health insurance coverage to employees working 30 hours a week or more. Cost containment strategy. If you have employees who are working different sets of hours, sometimes they work 25 hours a week, other times they work 35 hours a week, whatever the case is, we're going to average these things out. You want to make sure when they average out, if you do not intend them to be a full-time employee for health insurance purposes, you're going to want to actively manage them down under 30 hours a week. Because if they are averaging 30 hours a week and you've got them in a position, even if it's titled as a part-time position, but they end up going to the exchanges, and we'll talk about those later, and they try and get coverage to the exchange, this is all going to come up, and they're going to look at the time records, and they're going to say, why is this person averaging 35 hours a week and not being offered coverage? You do not, as an employer, want to be in that position. So you want to actively manage your employees.
And again, Mark, that 30 hours includes sick time, paid time off,
Yep.
jury duty, anything that they would normally get an hour of pay for.
You got it. Yep. So it includes all of that. So that's the first thing you need to know. That's your baseline. Now, the second thing you need to know, and it's appropriate to a lot of the attendees of this phone call, is controlled groups and having multiple entities with multiple tax IDs and tax returns and that type of thing. There's nothing to stop you from doing that, and that's all perfectly fine. And for operational purposes, that's probably what you do. And that's great, and you can continue to do that. However, for ACA purposes, controlled groups represent a single employer for purposes of determining whether or not you're subject to shared responsibility, and then for some other things that we're going to talk about down the road, non-discrimination testing and some other issues. So you're perfectly fine having multiple companies, but one of the strategies that came out early on was, well, if the cutoff's 50 employees and I've got 300 employees, I'm going to split my companies up so I only have 40 employees at each company. That's not going to get you anywhere because you're still going to be counted all as one company for purposes of seeing if you have more than 50 employees. So only do that if that's got some benefit outside of avoiding coverage. And that's another thing to say. The government is now actively coming out and saying, by the way, we know that we've got a whole lot of rules and there's a lot of complexities and there's probably loopholes that we haven't figured out yet, but we're looking. And if we see abusive practices, we are going to shut that down. Now, how effective they'll be at seeing them and identifying them and actually acting on them remains to be seen, but they are looking for it. So they've already shut down some things that could have happened that they found before these regs even went into effect, but after they published them, and so they've already been shut down.
Again, on that, Mark, if an employee were to work 15 hours for one of my FEINs, 15 hours for another one, under the control group, they're still considered a full-time employee because they've worked 30 hours.
Because they've worked 30 hours a week for a single employer, because the controlled group in that scenario is a single employer. Now, we'll talk about that. There is a difference as far as which entity is offering coverage, and we'll talk about that here in just a little bit. Now, the last thing you need to know about full-time employees is this concept of full-time equivalents, because that phrase comes up, are you subject to this rule? Well, you are if you have 50 or more full-time equivalents. So there's only one time that you deal with full-time equivalents, and that's to determine whether you're over this threshold. And basically what that is that you have to look at the prior calendar year. Each year you're going to do this. You're going to look at the prior calendar year, and you're going to say, okay, did I average 50 or more full-time equivalent employees? And the way you calculate it is you look at each month. And so for January of, the prior year, you say, how many full-time employees did I have? I had 30. Okay, great. And then of my part-time employees, how many hours did all my part-time employees work combined? They worked 1,200 hours combined. I take that combination of hours combined, I divide it by 120, and don't worry about where that number comes from. You just divide it by 120. You get a fractional number. In this case, it wouldn't be, but whatever. You get a number. You add that to your full-time employee count. You do that for each month. You do that January through December. You add all those numbers up, you divide it by 12, and you drop your fractions. And what you've done now is you've taken your full-time employee count plus your part-timers and converted them into their equivalent full-time employee counts, added them all up, averaged them out, dropped the fraction, and then you get a number. And if that number is 50 or more, you're subject to shared responsibility. If it's under 50, you are not subject to shared responsibility.
So just to clarify, so if I have an employee who works 20 hours a week, and I have another part-time employee who works 10 hours a week, you would add those together to get the 30.
Right.
And that equals a full-time equivalent.
And that would equal a full-time equivalent.
Right.
Mm-hmm. Okay, so and that's the last time you're going to deal with full-time equivalents. Some of you, a lot of you on the phone, you probably have, 75 full-time employees. So you don't even have to go through this exercise. You know you're going to be over, so you're just, you're subject to the rules.
And one more question, Mark, that came in regards to full-time employee hours for that 30 hours a week calculation. Holiday pay is also included in that 30 hours?
If you're paid for that time, whether or not you actually work, it's included.
And then how often should an employer be tracking their part-time employees?
Well, that's going to be an ongoing exercise, and that's one of the things that, and Chris is going to talk about this towards the end as well, but tracking your employees, especially your hourly employees, and how many hours they actually work is something you need to be able to do efficiently and consistently, because that's going to be your core HR function under the Affordable Care Act. The exchanges, the various agencies, they could ask you for that data at any time, and you will not have a week to get back to them. You'll have a couple of days to get back to them, because what's going to happen is you're going to have employees who are not eligible for your plan. They're part-time employees, and they're going to go to the healthcare exchanges, and they're going to, which are now called marketplaces, by the way, so you'll hear me use both phrases, but they're going to go to these exchanges, and they're going to apply for taxpayer-subsidized coverage. And the exchanges are going to need to know a lot of detail about them, and they're going to go back to the employer to get it, but they're going to need a decision right away. So you're going to get a letter, an email from it that says, Mark came to the exchange today and he wants subsidized coverage. We need to verify his hours. We need to hear back from you in the next 48 hours as to what he worked for the last 6 months.
And then it would be the 6 months, say, averaged on a weekly basis.
On a weekly basis. So you're going to need a system that's going to be able to provide you that data. Now, I'm making the 6 months up. We don't know what it's going to be.
It could be 3, it could be 2, but you got to have a weekly total going back X amount of weeks.
Right. And the first time you get that letter is not the time to realize, oh, crap, I don't have a system to do this. You need to be able to do this. And you need to start doing it now, by the way, because a lot of you are going to fall into what we're about to talk about, which is this variable hour employee tracking. And you're going to need to be tracking in 2013 to make sure you're offering coverage to the right people in 2014. But that's a very important point, Jason. I'm glad you brought that up. Okay. So we know what a full-time employee is. So a full-time employee is someone who is regularly scheduled to average 30 hours a week, 30 hours of service per week or more. Obviously, it follows a part-time employee is an employee who is regularly scheduled to not work at least 30 hours or have at least 30 hours of service per week. And when the statute was passed, that was it. You had full-time employees and part-time employees, and that was it. There were no other options. Now, what has happened is that a lot of commentary has flown back and forth between all the agencies and the public and everything else, and there's been this realization that there are a lot of people out there who are hired into positions that have no set hours, and where the employer doesn't know at the time of hire how many hours this person's going to average. They may average 45 hours a week. They may average 10. We don't know. We're not hiring them into a position that's clearly delineated as full-time or part-time. And so the IRS has come up with a third term or a third classification of employees, which is a variable hour employee. Now, you've got to be careful. The variable hour employee rules were published last summer. They were relatively, what's the best way to phrase this, loose with how you could term employees. A lot of experts, consultants, etc., got a hold of these rules and said, oh, well, I can manipulate it this way and this way and this way, and I'll end up not having to offer coverage to anybody. And they were right. As the rules were published, they were right. And then that, of course, got to the IRS at about a week. And shortly thereafter, we started getting all the warnings from the IRS. You can't take advantage of these rules, et cetera, et cetera. And they've subsequently been modified, and so it's now all official. So the bottom line is you can only use this variable hour definition for employees who are truly variable hour. If you hire someone into a part-time position and they happen to work all different sorts of hours, they're a part-time employee because you hired them into a part-time position. Same thing with full-time. So again, cost containment strategy. If you're going to have people that are going to work all different sorts of hours, you may think about changing your hiring practices so that you're not committing them into a full-time or a part-time position. That might be something you want to think about. You'd work that out with your consultant, your broker. Now, if you can, why would you want to tag someone as a variable hour employee? If someone is a variable hour employee, you get to measure their hours over a period of time before you determine whether or not you have to offer coverage to them. And that's good, because if they don't meet the criteria, then you're not going to have to offer coverage, which is going to reduce your costs. And if you do have to offer coverage, that's good, because then you can offer it without having being subject to the penalty. So how long can these measurement periods go? They can go upwards of 12 months, and that's the key to this thing. They can be as short as 3. I don't know of any employer who's going to use a 3-month measurement period, but they can be as long as 12 months, and that obviously is going to be something that employers are going to take advantage of. So let's dive into some of those details.
Mark, so I got a couple of questions in regards to that, and for temporary employees and seasonal employees.
Okay.
If we hire a temporary employee to work over 30 hours a week for a 2-week to say 6-week project, how would that person fit into this equation?
That person is going to be most likely a variable hour employee if you are the, well, a couple of things, okay? Number one, if you're not the staffing agency, they're not your employee. So you're not worried about them anyhow. It's the staffing agency's problem to figure out. Number two, even if they were your employee, which the argument can be made if you hired someone from a PEO, which is probably unrealistic in this question, but even if they were your employee, and we don't know if how PEOs are going to be handled here. This is one of those things as a sidebar that they haven't figured out yet. But let's say that person somehow became your employee. If you are clearly hiring them into a full-time position, but that position's only going to last for 6 weeks, well, you've got some practical planning you need to do. We haven't talked about it yet, but there are waiting period rules that come with the Affordable Care Act. And the rule is that you can have up to a 90-day waiting period, and I think a lot of employers are just going to switch to that or something similar to that. And so 6 weeks is not 90 days. So you would hire them, maybe a full-time employee, which would imply that you have to offer coverage, but if they're going to be gone after 6 weeks, it's a moot point because they're not going to make it through the waiting period.
But on that same example, if I hire them on a 6-month project, they potentially would be eligible for the benefits for the last 3 months of their project if they're hired on to work 30 more hours on a regular basis for that 6 months.
Unless they're seasonal, which gets to the second part of your question. If they're a seasonal employee, then you've got a very good shot at making them a variable hour employee. And so you would just, if it's seasonal, you're ramping up to accommodate a rush, a sale, the holiday season, something of that nature, and it's going to be for a defined period of time, and it meets the common, I'm going to call it, this is not a legal phrase, but the common sense definition of a seasonal employee, then you would deem them to be variable hour. That's what the variable hour rules are really intended for. You know, this is to separate the seasonals out from people who you try to make seasonal but really aren't, who are there full-time, that kind of a thing.
So if I'm, just an example, if I'm hiring a student to work the summer months for their time off, and they're in September, they're back to school, and they're only working for me from June to September.
Right. Then they're a seasonal employee.
Perfect.
Okay. So you would throw them into this variable hour. You deem them to be a variable hour employee. So how does this work? You're going to have measurement periods. The measurement periods is that period of time that you get to track their hours without offering coverage, regardless of how many hours they're working. You're not offering them any coverage during the measurement period. It can be as short as 3 months, as long as 12 months. And the purpose of this time frame is to assess the hours they're actually working, and that's all it is. You're going to measure their hours over this 12-month period of time. And when you get to the end of it, you'll do the calculation, and you'll know whether or not this person met the 30-hour-a-week average or they didn't. Now, measurement periods are followed by stability periods. This is the catch with these rules, is you get to measure them for up to 12 months, but measurement periods are followed by stability periods. And stability periods are the period of time that you have to offer coverage to those employees who actually end up meeting that 30-hour-a-week average during the measurement period. And you have to offer coverage to them for as long as that measurement period was. So 12 months, as long as A, they continue to pay whatever their contribution is, and B, regardless of how many hours of work they actually average during that stability period. So a 12-month measurement period comes with a tail of a 12-month stability period where you're offering coverage as long as they're employed. Doesn't matter how many hours a week they're averaging, as long as they make their payments, and they're employed, I should say, and I should reverse it. They're employed and making their payment, regardless of the number of hours they average, you would have to continue to offer them coverage. Or if you'd offer it, they'd enroll in it, and you'd have to maintain the coverage would be the technical phrase. I'm getting myself all discombobulated on this slide, and I apologize. But anyhow.
You went fine, Mark.
All right, so we're going to move on. So this is kind of an illustration of how this works, and we threw in one more thing here that you need to know, which is an admin period. Stability periods and measurement periods and all this other stuff, they all have their technical details, and one of the technical details is if somebody does make it through a measurement period and they do meet the average hours worked, and so therefore they're entitled to coverage, if they take that offer, they have to be covered as of the first day of the stability period. So it becomes problematic if your stability period date is the day after your measurement period ends. So the regs allow you to add an admin period as long as it's not longer than a total duration of 13 months, you can have an admin period that would allow you to process, get the offer out, process the paperwork, make sure, verify that they're on the plan, that type of thing, all those things that you need to do. I know it's very hard to read, and I believe we're sending out copies of the slides, so on your screen you may not be able to see this real well. What we did was we kind of laid out 3 years worth of measurement and admin and stability periods. And there's some detail on here we're not going to get into today because this is something you're going to need to work out. This is going to work differently for every employer. This is something you need to be working on with your broker or your insurance carrier, whoever's advising you on the Affordable Care Act. This is a strategy you need to have in place if you're going to take advantage of it. You need to figure out which way is going to work best for you. But basically, what's in yellow are measurement periods. What's in green is a stability period on the top. And that would be for ongoing employees, these year after year employees that you have that are variable hour. And then there's 3 examples, and that's new hires. When are you going to measure them, and when do their measurement and stability periods kind of fall out? And we showed 3 different ways that are allowed to do it. Example 1's a 12-month measurement period followed by a 1-month admin period, which is allowed. Example 2 is an 11-month or 9 months. I'm not sure. It's too many squares. I can't even read it. And then the 3rd example is kind of putting the measurement period in between the admin periods. And there's, again, there's different solutions that are going to work for different employers. The bottom line is this is another cost containment strategy. So if you're subject to the rule that you have to provide coverage, you need to provide coverage to your full-time employees. If you have employees who you don't know if they're going to be full-time or not, and you can't actively manage them to be one or the other, and they're in a position where the hours are going to be variable or seasonal, as Jason was saying, then taking advantage of the variable hour rules is going to definitely be something you want to look into.
So we got a couple of questions, or actually a lot of questions regarding this, Mark.
Okay.
So if I have an employee who I've averaged out in my, let's say I set it for 12 months, and I've averaged out my look-back period, and that person actually has worked over 30 hours a week for that last 12 months, then they would be considered a full-time employee and eligible for coverage
during the stability period.
During the stability period. So now that person's on my plan. But what happens if that person's no longer working for me? Then there's no one to offer coverage to.
There's no one to offer coverage to. So if they terminate their employment during their measurement period and they didn't have any other coverage or whatever, then they're gone. They're just gone.
What if I just don't let people work for me for more than 12 months?
All right. So there's this general rule. And this general rule is that you're not supposed to set up your eligibility rules in such a way and then manage them in such a way that you are offering coverage to employees yet never making them eligible for it. So you'd have to be careful. Now, you have active reasons, obviously, all the time. People don't work out, whatever the case is, and that's fine, and they can't stop you from doing that. But if you set up a pattern of hiring variable hour employees and you never, ever let them get through the measurement period, that would be a red flag. And indeed, the IRS has published a rule that says, starting in 2015, not in 2014, but starting in 2015, you are not allowed to take into account the likelihood that the employee is going to remain employed throughout the measurement period. So what that means is you've got to make that decision as of day one. Are they variable hour, full-time, or part-time? And in the variable hour calc, you cannot take into account if they're going to be with you through the measurement period. How that's going to get enforced is a different question. We don't know. How they're going to track it, we don't know. There's a lot of tracking we're going to talk about in a little bit. There's a lot of reporting that's going to be happening that you don't do currently, and it's information the government doesn't currently get about your plan. But that's all coming too. So there's going to be a way to track it. We just don't know how yet.
And just I mentioned this before, but just to ask you again, we need to start tracking this today, correct? Because 2014 is when I have to have my first calculation set on who's eligible.
Correct.
So if I'm not tracking hours today, I need to start immediately?
Yeah, pretty close to it. 2013 is your last chance to work out all the kinks. you need to be going into January 1, 2014 with two things. One, you need to have something in place that you know works, where you can do all these calculations. Number two, for your variable hour employees that you have today, you need to find out whether or not you have to offer them coverage effective January 1, 2014. And the only way you're going to do that is if you get your measurement periods up and running in 2013. So again, this is something to be working on right now. Just as a general rule of thumb at Assurance, we've been working with our clients on some of this stuff since last summer to get them up to speed. And now is the decision time where they're starting to make these measurement period decisions. Now for 2013, you might intend to use a 12-month period, but you may not have enough time to do that. They are going to allow you to substitute a 6-month period for just this transition. But there's some catches with that, but they're going to allow you to do that. And some of you may not need to be compliant 1/1/14. You may need to be compliant 3/1/14. So you may have a little bit extra time. But now, if you haven't thought about this at all, if this is new to you now, then you've got your marching orders. You need to get started up on this. And otherwise, you're going to run out of time. The exchanges don't open January 1. The exchanges open October 1. And October 2 is when you're going to start getting these letters from the exchanges that, hey, so-and-so applied for coverage. Where are we at? So you don't have until the end of the year. You have until the fourth quarter, the beginning of the fourth quarter. And that's when this stuff's all going to start going, and you need to be up and running and ready to rock and roll.
So if your intent is to keep a person as a part-time employee, they need to be averaging less than 30 hours a week now, right? And that calculation is going to, the first time the IRS could possibly look at that will be on October 1st when the exchanges come out.
Right.
And that person is going to be defined as a part-time or full-time employee based on the hours they worked in 2013.
There's going to be a little more detail to it than that, but generally speaking, yes, that's correct.
Perfect. Thanks, Mark.
All right. Okay, so for the sake of time, we're going to keep moving on, keep the questions flowing. So we defined our full-time and part-time and variable hour employees. What else do you have to do? You have to provide a plan to these full-time employees that meets minimum value. Minimum value is a plan that meets 60% actuarial, or has a 60% actuarial value. What does that mean? That's a technical phrase, and it's something you really probably don't have to worry about too much. We'll talk about that. Actually, this is an intro slide, so I guess we'll talk about that on the next slide. It has to be affordable. Your coverage has to be affordable in terms of employee contributions, and it has to be offered on a non-discriminatory basis. So what does 60% actuarial value mean? Well, it has to be a comprehensive group health plan. Comprehensive and group. Individual plans do not work even if they're comprehensive. It has to be comprehensive group health plan, which means no limited or mini-med plans are going to be allowed. There may be a little transitional relief going into 2014, but in very narrow circumstances. And certainly sometime within 2014, you will have to transition them onto a comprehensive group plan. That plan has to meet insurance reform guidelines. If you purchase your plan through a health insurance carrier, it is highly likely that that plan has already had all the changes done to it that need to be done to get it into compliance with the ACA. The carriers, by and large, have not screwed around with this, and they've been getting everything in shape so that you're ready to rock and roll. And indeed, they cannot sell you anymore, starting in 2014, a plan that isn't in compliance with all the ACA regs in terms of the insurance reforms. Has to cover doctors, hospitals, specialists, prescriptions, preventive care, and a list of other categories of expenses. Again, it's a comprehensive plan. It's going to cover what you expect it to cover from a comprehensive plan. It cannot have annual or lifetime limits on certain benefits, and there is a cap on annual out-of-pocket expenses. The good news is if you offer major medical coverage today, even if it's not to all the full-time employees, but you at least have a plan in place, and it's comprehensive major medical, it is highly likely that it's going to meet all of these criteria already. There's not going to be a lot you need to do, if anything, to get your plan in compliance here. The only exception to that would be if you had a major medical plan that was grandfathered. If it was grandfathered, then and it remains grandfathered, then fine. You don't want to do anything, because as soon as you do something, you're going to lose the grandfathered status. But if you are to lose grandfathered status, then you're going to have to get into compliance with these things. But again, if you've got an insured plan, that should be a relatively straightforward exercise. If you have a self-funded plan, then hopefully you've kept on top of this. Again, if it's grandfathered self-funded plan, keep it grandfathered if that's your intent. If you don't know what grandfathering is, don't worry about it. It's not going to apply to you if you don't know what it is at this point. But if it's a non-grandfathered plan, you got to make sure that you're in compliance with these rules.
So in essence, the 60% rule is going to apply to me if I'm fully insured or self-insured. I've got
exactly. You're still going to have to meet that. Now, I should define what that means real quickly. What does 60% actuarial value mean? Basically, what they say is that it's not measured on your specific group and your specific group's claims. What they do is they take a look at your state, and they randomly select a group of people that are covered by insurance in your state. And then out of that random selection, they randomly select likely claims that that random group may have. And then they say, given this random set of claims, would your plan pay, on average, at least 60% of the cost that these random employees would incur? And health insurance carriers, given product designs that they've been offering traditionally for years, offer plans that have much higher actuarial value than 60%. They actually have a hard time getting to a 60% plan without violating other parts of the ACA. So a 60% actuarial value plan is not going to be a hard thing to meet. And what you need to know as an employer, you're not going to have to do all these actuarial calculations. And if you're self-funded, your TPA is. But again, there's going to be, this is not going to be a hard target at all to me.
That's required for just one plan. I can have plans that are obviously richer than that.
Yeah, and that is true. All of these rules that we're talking about, aside from insurance reform guidelines, any plan, any medical plan you offer has to meet the insurance reform guidelines. But in terms of the actuarial value, you only have to have one plan option meet that guideline. You can have other plan options that wouldn't meet that. Now, that's not realistic. All your plan options are probably going to meet the 60%. But there's also the affordability from a premium perspective, and that's where your multiple plan options, you might have one that meets it and then others that don't. So this is important. Here's where you need to pay attention to the details. Your plan has to be offered in a way that it is affordable to your low-wage employees, and that means that nobody can be required to pay more than a certain percentage of their income for their insurance. Now, the statute, the law that Congress passed and that the President signed, and that the exchanges are going to use as their criteria, is that coverage is affordable as long as the employee does not have to pay more than 9.5% of their household income for health insurance coverage. Now, as an employer, you're not going to know what household income is. There's no way for you to track it, yet that's what the exchange is going to use, because there is a way for the exchange to track it. So there was a lot of comments that went back to the IRS and said, wait a minute, this is not fair. We don't know household income, so the only time we're going to find out if we're in compliance or out of compliance is after we get penalized because we were out of compliance, because there was no way for us to anticipate one way or the other. And the IRS said, you're right, at least as far as there's no way to participate. I don't know if you're right about the fair thing, but they said you're right. And what you need to do is make sure, we're going to give you a safe harbor. A safe harbor is an optional way of doing things. As far as this one goes, I know of no employer who is not going to take advantage of this. Everyone's going to take advantage of this. And the safe harbor works this way. As long as the employee does not have to pay more than 9.5% of their own Box 1 W-2 wages for individual coverage, employee-only coverage under your plan, you will not be held liable for any penalties because your coverage will be deemed to be affordable. So that's the bottom line. You have to make sure that for employee-only coverage, your employees have a plan option that's not going to cost them more than 9.5% of their Box 1 W-2 wages. To put this in perspective, a minimum wage employee at $7.25 an hour, which I believe is the federal minimum wage, it's going to be around maybe a little under, maybe a little over $100 a month is the max that you could require them to pay in order to be within the bounds of this rule.
So I can charge my employees, say, up to $100 per month to be on one of these 60% value plans.
Right.
And then I don't have to contribute anything towards the dependent coverage, correct?
Correct. Yeah.
It's only reliant on my actual employee.
Right. Correct.
Thanks.
Yep. Easy to do. So that was the initial safe harbor. We've subsequently gotten 2 more safe harbors. So the first one is charge everybody 9.5% of their income for employee-only coverage, and you're done. Administratively might be something you need a solution for, but it's the most cost-effective option for you because you're always charging people the most that you can charge them. The other thing you could do is if you have a lowest base rate of pay for a full-time employee, you have a set lowest base rate of pay for any full-time employee you bring on board. You can annualize that number and then do the calculations and base the 9.5% on that. Or you can base it on the federal poverty line. Just as a side note, someone who qualifies for Medicaid is not someone you have to worry about. You're not going to get penalized for them going on Medicaid. So you can make them ineligible for your plan. They can go on to Medicaid then, and you're fine. You're good.
So if they're earning, that Medicaid line is 133% of the federal poverty level, correct?
In some states, it's going to be 133% because the ACA expands Medicaid to 133%. In some cases, it's going to be less than that because some states are not going to expand Medicaid. So what happens if you don't do what you are, what they want you to do, which is offer coverage? Well, there's some penalties involved, okay? The first penalty is if you decide not to offer any group health coverage. And I'm here to tell you that, we have a model here at Assurance that we use. There's other models that other consultants use. When you run all the financial data and you take the proper strategies and you put them in place, chances are you're going to find that complying with the coverage requirement is going to be your most cost-effective option. There will be some scenarios where that's not true, and we have a few, like maybe 3 or 4 clients where it's not the case out of the hundreds that we have. But for the most part, the rules are set up in a way that if you have group health coverage today and you're offering it to your full-time employees, by and large, you just keep doing what you're doing. You may have to change who's a full-time employee, but it's not going to be such a dramatic increase in cost that it's going to cause you to think that you should not offer coverage. But if you choose not to do it, then there's a penalty, and that penalty is $166 per month per full-time employee that you don't offer coverage to. Now remember, this means you're not offering it to anybody, and that includes yourself as an owner. If that's who you are, you would not be able to have a group health plan. And you're going to pay basically $166 a month or $2,000 annually for each full-time employee you have minus the first 30. They give you 30 employees for free. After that, you have to pay the penalty.
Now, if I have an employee who, let's say I don't offer coverage, but they're on their spouse's plan, I still have to pay the $2,000 penalty. Does it apply to all my employees?
I have to offer it to my full-time employees. If they don't take it and they go on to their spouse's plan, I don't get penalized. But if I don't offer coverage at all, regardless of whether they have coverage or not, yes, I'm going to pay a penalty. Now, we talked early on about controlled groups. One little last note here. If you have, let's say you have 3 entities, and one of them decides not to offer coverage, the other 2 do offer coverage, you're only going to get penalized on the one not offering coverage. But you can't just take the 30 freebies out of that one that's not offering coverage. You have to divide the freebies up by however many member companies there are in the controlled group. Now, there's a different penalty. If you choose to offer coverage, but it doesn't meet the affordability guidelines, in other words, it doesn't meet 60% actuarial value, an unlikely scenario, I should say, or you charge more than 9.5% of an employee's Box 1 wages for individual coverage, which is actually a strategy to consider. because your risk is much less, then the penalty is $3,000 for each employee that goes to the exchange and gets subsidized coverage. And that's a key point. There are no penalties if none of your employees ever get subsidized coverage. The likelihood that none of your employees are ever going to get subsidized coverage is pretty small. So that means the likelihood that you're going to get penalized is pretty large if you choose to violate or not fully play along. But the point is that whereas that first one, I have an attorney friend of mine who calls that the sledgehammer penalty, $2,000 times all your full-time employees. This next one he calls the tap handler penalty because it's $3,000 times whoever does get subsidized coverage. So that's an option. I don't know that I would necessarily recommend it, but if you're on the fringe and it's the difference, between doing this and not doing this, it's something to consider.
Just quickly, if I have less than 50 employees, I don't have to worry about a penalty.
You don't have to worry about anything that we've talked about other than if you do offer coverage, it has to be non-discriminatory and it's got to meet healthcare reform insurance guidelines. But you don't have any of this affordability. You don't have any of that stuff that you have to deal with.
And I can charge 9% of income on all my employees up to, say, the cost of the insurance.
Yep.
I'm not paying more than the cost of insurance.
9.5.
So I can do the 9, and I'd be in compliance. So. Thanks.
Okay, now, so we have the sledgehammer penalty. We have the tap handler penalty. If you say, you know what, I'm going to offer coverage to my managers, but nobody else, and nobody else includes full-time employees, then you got a non-discrimination issue. That's not a good one to have because that penalty we're anticipating, it's not highlighted yet, but we're anticipating that penalty is going to be $100 per day per affected individual, or as I like to call it, the nuclear annihilation penalty, because that one can get real expensive real fast. It caps out at $500,000 for the year, and that is not one that you want to be incurring because if you do incur this penalty, unlike the other two, what's going to happen is that the agencies are going to come in, they're going to hit you with these penalties, which, by the way, are not deductible expenses. These are after-tax, excise tax penalties. They're going to hit you with this penalty, and then they're going to come in and say, and by the way, you have X amount of days to get into compliance. So you're not going to avoid things by just paying this penalty. You're going to have to get into compliance as well. So you don't want to do this. You would also be assessed this penalty if you continued somehow to offer a mini-med or a limited medical plan or some other plan to your full-time employees that did not meet the ACA's insurance reform requirements. With that, that wraps up my part of it, unless there are any questions, Jason, or do we want to get to Chris?
Yeah, why don't we let Chris go? I've got a ton of questions. Maybe Chris could go through his stuff, and we could spend like maybe 5 or 10 minutes after 1 o'clock to review a few more questions.
Chris, it's all yours.
All right. Thank you, guys. And thank you, Mark. And just to let everybody know, we're going to have, like Jason had just mentioned, we're going to have more question and answer coming up. And also all questions that we aren't able to get to, and actually all the questions that everybody has been so kind to submit during today's presentation, we're going to cover again in a question summary document that we're going to be emailing out to all attendees in the next week. So I definitely want to thank you, Mark, and everybody for being here today. And as we can all see, the Affordable Care Act it's truly a fluid and changing document. And for those of you on the call that are new to Alliance Payroll, just to let you know, we deliver online workforce management services to thousands of clients all across the country via our All-Pay application. We use our client crowdsourced ideas to come up with updates that we implement in our All-Pay application 3 to 4 times each and every year. So our clients on the call, you already know that last week we rolled out our spring 2013 release of All-Pay. And in this release, clients now have access to a feature-rich section for the management of the Affordable Care Act. So teaming up with Alliance Payroll and your benefits provider is going to ensure that you stay current on all the provisions of the ACA. Now let's go ahead and take a look at how Alliance Payroll Services is going to help you simplify the task of your ACA management. In the W-2 section on the previous slide of the ACA portal, you can easily see how many W-2s Alliance Payroll produces for your company in the previous year. And therefore, whether you're subject to this reporting provision or not. If you are subject, for your convenience, your W-2s are going to be placed on automatic hold by Alliance Payroll until we receive the premium information from you via your insurance provider, thus ensuring that the ACA provision is accurately reported on your employees' W-2s by Alliance Payroll. What you're looking at now is the hourly setup section of our ACA management portal. So this allows your employers that desire to know which of your variable hour employees are averaging 30 or more hours per week. For this calculation, the hours that are subject to, as Mark had covered in our session today, the service hours that he had talked about, are any worked hours plus any hours for which the employee did not work but they were still paid for, such as vacation, jury duty, etc. For this calculation, you can easily choose the subject hours from the pick list of actual hours Alliance Payroll is using to compensate your employees. Of course, your customer support personnel at Alliance Payroll are going to be glad to help you in setting up these eligible hours with input from you and your insurance and benefit broker. In the deduction section of our ACA management portal, and this is where you track the lowest cost insurance contributions for your employees to make sure that they don't exceed 9.5% of their annualized wages, or as Mark had talked about, the box 1 of their W-2. So what this area allows you to do is easily track the deductions. For instance, if the deduction is an employee-only medical plan, 100% of this deduction is probably attributed to the employee. And if the deduction is employee plus spouse, perhaps only 50% of the deduction is attributed to the employee's coverage. These percentages are supplied by your benefits provider and entered here so that they can be used in the calculation to make sure that the employee's lowest cost contribution does not exceed 9.5% of their annualized wages. So when we look at the hour setup area of our ACA portal and the deduction setup area of the ACA portal, what we're doing is we're clearly defining your hourly earnings codes and tying them back to your variable hour employees, as well as clearly defining the benefit deduction percentages that are going to be attributed to the employee's annualized wages. And this is critically important so that you can easily produce accurate ACA management reports. So when Mark was talking today about your stability and your measurement periods, you're going to want to make sure that whatever system you're using to manage your payroll, deductions, and your ACA reporting is something that can be easily customized and set up with the support of your benefits provider and automatically tie that data back to your ACA reports in a quick and digestible format. And we look at the reporting that's available. So at Alliance, we provide some very powerful reporting tools for the administration of the ACA. You can easily run a report for the date range defined in your look-back period or any customizable date range you choose to evaluate. Think back to the measurement periods, the stability periods, and the administration information that Mark had talked about in our presentation today. The report's going to display your employees' average hours, with anyone averaging 30 hours per week or more being flagged with a positive variance. The variance in the benefit data will also show anyone whose lowest cost deduction amount exceeds 9.5% of their annualized wages. And this is going to be signified by a negative amount in their variance column, indicating their insurance deductions exceed the allowable amount. Now on the next slide, you're going to see one of the most compelling features of our All-Pay ACA administration portal, and that's the automatic notification that can be sent to your managers or administrative team of which of their employees are near a certain average hour threshold. In All-Pay, you simply define the contact name, email address, store, or department location, and what hour threshold you would like the contact to be notified. And our All-Pay system will automatically send the contact a list of their store employees that are above the average hour threshold after each payroll processes, so that the manager can take appropriate action if your company desires to keep the employee within a certain average hour range within your look-back period. Because we update our All-Pay application 3 to 4 times a year with our seasonal updates based on ideas we receive from our clients, winter, spring, summer, and fall, we're going to continually be updating the ACA management portal within All-Pay to reflect any changes in the administration of the Affordable Care Act. And as Mark was talking about his joke today, and he said that the original law had 2,000 pages and the regulation updates were 7 times as thick, we can all expect many more updates to come in the months ahead as we gear towards 2014. So the All-Pay system is in a good position to be flexible and updated as the changes come through, so that you and your team is going to always be confident to be compliant when working with Alliance Payroll and our ACA portal application. So now we're going to go back over to Jason and Mark and review some last-minute questions that have come in. So Jason and Mark, go ahead.
Thanks, Chris. We want to be respectful of everyone's time, so I thought the majority of questions that we're getting are really going back to the variable hour and measurement period calculations. So Mark, we're getting quite a bit asking about the look-back period and how these hours would be averaged out. So let's say I'm in retail, okay, and I've got employees working a big group of hours in the summertime, or maybe it's the holiday period, and so they're going to average over 40 hours a week during those 3 months. But maybe the rest of the year, they're working less than 30. If I set my measurement period for 12 months, as long as they average less than 30 during that entire period, am I okay at that point in time?
Right. They would be part-time employees in that scenario. And to take it one step further, with the caveat that none of this hasn't been finalized yet, but there's talk about in some of the preambles, and HHS has been looking for public input on what's truly seasonal and not seasonal. So what they have said for now basically is that a person who is averaging 40 or over 30 hours a week for a relatively short period of time is not sufficient to kick you over into either A, them being a full-time employee, or B, to kick you over into that 50 full-time equivalent threshold, at which point you're subject to shared responsibility. So I believe off the top of my head that duration is 4 months, but I know the IRS has an example in some of their commentary on the same subject of an 8-month seasonal employee, thinking about, say, guys who work on the roads, or people who do landscaping in certain regions of the country where it's not a year-round venture, but it is still seasonal. There's no straight across-the-board definition of seasonal yet. That's our issue. That's the issue, which would figure out this scenario. But the intent, the best I can say is the intent of the regs right now and the intent of the regulators, which is important because they're the people enforcing all this stuff, is that somebody working for a specified part of the year in what is reasonably a seasonal function or a seasonable set of hours is not going to be sufficient to kick them into a coverage requirement or to kick you into the shared responsibility provisions. So I think you're okay. Now, if seasonal ends up being 11 months, I think you might have an issue. But if you're talking 4 or 5 months, you're going to be in good shape.
We're getting also in regards to the stability period. So let's say I set a 6-month look-back period, okay, and that person, after my 6-month calculation, comes out to be more than 30 hours a week. Now they can stay on the plan for 6 months, correct?
Right.
And at the end of that 6 months, now they are no longer meeting the 30 hours a week,
right?
And they would then come off my plan.
Right.
When do I measure them again?
Okay, great question, and I'm glad you brought that up, Jason, because we didn't talk about this. So the first measurement period ends, your initial measurement period ends. It's immediately followed by a stability period with the potential of an admin period in between. We talked about that. But what also happens is once you make it through your initial measurement period, you're going to fall into what's called a standard measurement period. Standard measurement periods are basically your default for your variable hour employees who have been with you through at least one initial measurement period. So the bottom line is that they immediately start getting averaged again. The time frame will be a little bit different. It's a little complicated to get into in this format. But the bottom line is measurement periods, the easy way to think about it, a measurement period is followed by both a stability period and another measurement period. And then that measurement period is going to come to an end, and it's going to be followed by a stability period and yet another measurement period. So the measurement periods are perpetual. They just keep going. They keep going. It's the Energizer Bunny. They just keep going. And whether or not somebody has to be offered coverage during their stability period is irrelevant. As long as they remain a variable hour employee, you're always going to be measuring their hours. It's just which measurement period are they in, and then if for that particular measurement period is going to be paired up with a stability period, and so if they meet the requirement for that paired up stability period, they'd have to be offered coverage.
So for an employee who doesn't take coverage, I have to keep measuring this person, and I have to keep offering them coverage at the end of their next measurement period. And if they, so every year, potentially, I have to get this person to decline coverage.
Well, you just don't have to offer it to them because they're a part-time employee. And some of you may be asking, well, what's the alternative? Because this is a lot of admin work, and it is admin work. You know, Chris has got a system that could help you out with parts of this and do a great job with that. The alternative is you can measure everybody every month, which you probably don't want to do because that's more admin work than measuring them once a year. But yes, that would be, that's the default is, if you elect not to use the variable hour safe harbor, then everybody's a full-time employee or they're a part-time employee. There are no variable hour employees, and in that scenario, you have to measure everybody once a month. That's a lot of extra work. So, you know, if you've got employees that are going to fall into that variable hour category, such as seasonal employees, then you want to be taking advantage of that safe harbor. But it was built specifically for that scenario, so that's, you know, yes. Go ahead, sorry.
That's okay. So if I hire somebody to be a full-time employee, I don't have to measure them because they've already, by hiring them as a full-time employee, I've classified them as eligible for my benefits.
You got it.
Even if they don't work 30 hours a week.
Doesn't matter. You've hired them into a full-time position. You reasonably expect them to average at least 30 hours a week, 30 hours of service per week. Otherwise, why did you hire them into a full-time position is kind of the logic.
Perfect.
Okay. Now, I know that's the logic, and that's not necessarily how things work in the real world, but the law has a certain logic to it, and that's how they set it up.
So last question in regards to the measurement periods are, if I have high turnover, and I have to be measuring these employees every month, because of my turnover, majority of people aren't going to make it to the end of the measurement period.
Sure.
So in that situation, I don't have to worry about them. I only have to worry about, well, I have to measure everybody, and at the end of my, say, 12 months, I'm only worried about, I'm offering coverage to the people who met the 30 hours and are still employed.
Are still there, right, Yeah, obviously, if they're not there at the end of the measurement period, they're not there.
Okay.
You don't have to do anything. Now, if somebody was in their stability period, let's say they made it through the 12 months, you offer them coverage, they take it, now they're in their stability period, and they can no longer, 3 months into their stability period, they leave, okay? What happens in that scenario? Well, now you've got an ex-employee, so you would terminate them, you would offer them COBRA. Chances are they wouldn't take it because, if they're unemployed, they're not going to have enough money to pay for the COBRA. But you would have to offer COBRA. You are going to have a COBRA qualifying event and all the notifications that go along with that.
And then just last,
sure.
The reason I'm tracking this, even if they're no longer with me, is that I have to be able to prove to the IRS if this person were to apply for a subsidy,
to the exchange, correct.
To the exchange, excuse me, that they did not meet the requirements of a full-time employee, which is why they were not on my plan or offered my plan.
Correct. So what you're trying to avoid here is if you have an employee who goes to the exchange and does qualify for taxpayer subsidized coverage, which is not Medicaid, so they're outside of Medicaid, but otherwise they're within 400% of the poverty level, they're going to qualify for a subsidy. That poverty level calculation is based off of family size, and that, again, you're not going to know that. So what you're trying to do, your goal as an employer, if you're subject to shared responsibility, is set everything up so that in the event that employee still ends up getting a subsidy, you're not penalized for it. The first thing that they're going to do, the exchanges are going to do when the employee applies for the subsidy, is cross-check their records with your records. And that's, again, why the record tracking system is so important that Chris was talking about. Whatever tracking system you have. We have a client, one that Jason and I both work on, who has a couple thousand employees for whom they have about 30 different record tracking systems. And so we're going through this process with them of trying to help them figure out how this variable hour stuff's going to work for them. And the problem is they have no consistent way of pulling any of this data. So their job is infinitely harder now than it should have been, honestly, had they, figured out a consistent tracking system across all their different locations. So that's the kind of practical thing. That's not a law. The law is you're going to get a letter, and you're going to get a specific period of time to respond to the letter, and you better respond accurately. That's what the rules are. But practically speaking, you got to have something behind the scenes to help you with it.
Perfect. Okay. With that, Mark, thank you so much. It was excellent. I'm going to turn it back over to you, Chris.
All right, thank you, guys. I want to thank everybody for attending today and all of the wonderful questions that have come through. We did a good job of getting to a lot of the questions. We still have some open questions, and I once again want to just let everybody know that we are going to go through each and every question that was submitted online today and create a question summary document that we are going to email out to all attendees, and that email will also contain a link to the recorded webinar. So thanks you everybody for attending today's event, and I want to especially thank Mark and Jason over at the Assurance Agency for putting on and conducting our regulation webinar update today on the Affordable Care Act. And thank you one more time for attending today's event, and we look forward to working with you soon.
Have a great day, everybody.